Melissa Zimmerman, and this is my informative speech. Let me take a wild guess. You're concerned about seasonal affective disorder, the winter blues, or do you have spring fever? When some people think about the winter months, they get that glum feeling. Does seasonal depression have any cognizancy, or do we just get anxious when the temperature turns from burning to freezing? I'm talking about seasonal affective disorder. Have any of you ever felt this way or know someone that has? I've done my research through 2 different books, a magazine article, and the internet. Today I'm going to explain what SAD is, also known as seasonal affective disorder. I will inform you of the signs and symptoms, treatments, and different diagnoses. First, I will explain the signs and symptoms and tell you a little bit about seasonal affective disorder. Seasonal affective disorder refers to those depressed during the fall and winter months. They improve within days of moving from cold to warm climates or from areas with short to long exposures to the daylight. Jared Maxim and Nicholas Ward wrote the book of Essential Psychopathology and its treatment. Gerald and Nicholas also state the signs and symptoms are when depressed patients tend to eat more, sleep longer, or later in the morning. In a magazine article written by General Psychiatry, Volume 58, a circadian signal of change of season in patients with seasonal affective disorder, state the symptoms of SAD, which include weight gain, increased sleep, decreased activity, and loss of interest in sex. WebMD Online have some of the similar symptoms, but also add difficulty concentrating, low energy and fatigue, reduced interest in daily activities, especially social events, moodiness, increased appetite, craving for more carbs, weight gain, increased sleep, and loss of interest in sex and irritability. There are some different diagnoses for SAD. It can be sometimes hard to tell the difference between non-seasonal depression and seasonal affective disorder because many of the symptoms are the same, according to WebMD Online. They state the doctor will ask you if you have been depressed during the same seasons and have gotten any better when the seasons change for at least 2 years. Also, a close relative, a parent, brother, or sister, if they have it, that could also be a trigger. You have symptoms that often occur with seasonal affective disorder, being hungry, weight gain, and sleeping more than usual. Jared and Nicholas say clinicians should inquire about seasonal patterns of mood with every patient who presents any type of mood disorder. Diagnostics and Statistical Manual of Mental Disorders, written by American Psychiatric Associations, state the prevalence of winter-type seasonal patterns appear with vary of latitude, age, and sex. Prevalence increases with higher latitudes. Age is also a strong predictor of seasonality, with younger patients at a higher risk for winter depressive episodes. Women comprise 60 to 90% of persons with seasonal pattern, but it is unclear whether female gender is specific risk factors over and above the risk association with recurrent major depressive episodes. Some research suggests that a seasonal pattern may also describe the presentation in some individuals with recurrent winter depressive episodes that do not meet criteria for major depressive episodes. Finally, I will discuss the different treatments. Regular exposure to light that is bright. Fluorescent lights help in the winter and fall months, used daily in the morning and evening. The temperature change, locations to a climate that is characterized by bright light, such as Mexico or the Caribbean. Light treatments has also been called phototherapy, commercially available in the form of light boxes. You use approximately 30 minutes daily, and it's 25 times brighter than normal lights. Just like you see here on the screen, those are the light boxes, and those are the light bulbs that you can buy for those. Also, you can surround yourself with social support that will benefit your mood. And finally, antidepressants are also given to patients, but may have side effects such as insomnia, nausea, diarrhea, and decreased sex drive. So the doctors try the other therapies before resorting to medications. So now that I've explained what seasonal affective disorder is and told you the signs and symptoms, treatments, and different diagnoses, do any of you feel that you have this disorder?